World Hemophilia Day. The World Hemophilia Day is celebrated on the 17th of April 2024. The theme for the year 2024 is Equitable Access for All, recognizing all bleeding disorders. The theme for World Hemophilia Day for year 2024 is Equitable Access for All, recognizing all bleeding disorders. This theme emphasizes treatment for all and envisions a society in which every individual with inherited bleeding disorders has access to care, regardless of their kind of bleeding conditions, gender, or location. World Hemophilia Day is a global healthcare event celebrated on the 17th of April every year. It was started by the World Federation of Hemophilia with the intention to raise a call for the government authorities and local policy makers for the provision of a better treatment and care in addition to promote better control and prevention of hemophilia. A rare, severe, inherited hemorrhagic disorder, hemophilia is caused by malfunction of factor 8 and factor 9 protein factors required for blood clotting or coagulation, leading to an abnormality in blood coagulation. Although people of all races and ethnicities can be diagnosed with hemophilia, men are more likely to be affected to the X chromosome. There is a 50% probability that a boy whose mother carries the hemophilia gene will also be affected by hemophilia, and a daughter being 50% risk of being carrier. Hence, hemophilia is more common in males despite the fact that it can affect females, causing difficulties with menstruation and childbirth. The importance of World Hemophilia Day. In the year 2000, it was estimated that 4 lakh persons, or around 1 in 10,000 live births, were affected by this disorder worldwide, and only 25% of those affected had access to adequate treatment. In 2019, however, a meta-analysis showed that the number of men with the inherited bleeding condition is far higher at 11.25 lakh. Even in high-income nations, only about 15% of the general population has access to effective treatment for hemophilia. The lack of response for diagnosis and treatment leads to high mortality and morbidity rates in low and middle income countries. This year, World Hemophilia Day is celebrated its 31st anniversary with activities focused on encouraging the public to support government and policy makers for the provision of better treatment, prevention and control of bleeding in persons suffering from bleeding disorders. The history of World Hemophilia Day. World Hemophilia Day was first celebrated on the 17th of April 1989 by the World Federation of Hemophilia to honor Frank Schilbert's birthday, the founder of this organization. Hemophilia wasn't discovered until the 10th century, when people started paying attention to its disproportionate number of male victims from suffering small accidents. This condition was referred to as abulcasis at that time. However, this could not be treated owing to technological constraints. An anticoagulant was commonly used to treat a disease that was rampant among these families at the time. However, the anticoagulants and the blood and this worsened the condition. In 1803, Dr. John Conrad out of Philadelphia began researching the bleeders, who eventually concluded that the disease was passed down from mothers to sons. In 1937, hemophilia was classified as a type A and B genetic disorder. However, effective treatment had to be developed to that point. Year by year, themes for World Hemophilia Day. World Hemophilia Day in 2023, the theme was Access for All, Prevention of Bleeding as the Global Standards of Care. The World Hemophilia Day 2022, the theme was Access for All, Partnership, Policy and Progress. The World Hemophilia Day 2021 theme was Adapting to Change, Sustaining Care in a New World. In the year 2020, the theme was Get Involved, to carry the motive of the World Federation of Hemophilia. So this is how this has progressed. In the year 2019, the theme was Outbreak and Identification. In 2018, the theme was Sharing Knowledge Makes Us Stronger.